Please welcome Peter Aiken.
Thank you, Tom. And my job is only to welcome Ranjana Young to this session here. We've been looking forward to this all day. Ranjan has been involved in a number of data leadership positions. Actually, if I count on her resume here, I think I see 5 or so positions that you've had with various organizations in various industries, including finance, and of course, what you're going to talk to us today about healthcare in this. And your story involves the way in which COVID has particularly impacted what you've done as a data leader, but also how you as a data leader have helped the business cope with the uncertainties that have been facing all of us in this particular session. So as always, everybody, please drop your questions in the chat function. Sorry, I said the chat function, in the Whova function of the Q&A piece for our session here, and we will pass those to Ranjan, and she will try to address as many as she can after she finishes her presentation. I am going to now turn it over to Ranjan because she's who you want to hear at this point in time. Ranjan, thank you so much for joining us.
Thank you, Peter. Thank you for this opportunity. So let me introduce myself a little bit. I am Ranjana Young. I lead our enterprise data function at Cardinal Health. It's been about I want to say about 14 months since I've joined the organization. As Peter mentioned, I came from a financial services background, worked with many organizations, both in the consulting space, serving many of the financial institutions, and also directly for Northern Trust and Schwab. So the shift to healthcare has been very, very intriguing and interesting. So I want to talk a little bit about that today. So healthcare industry overall is evolving. Technology disruption is proving to be a key player there. There's quite a bit of shift in care patterns that is occurring. And also there's a growing power of consumers that's happening as well. So I think the pandemic has accelerated kind of the journey to digitization. One example I can provide, I think there was a survey done by telehealth, the telehealth services overall from February 2020 to today have increased by 78 times. And I think they've kind of evened out to like 42 times now, which clearly shows adoption by consumers for digital platforms, which if we had talked about 2 years ago, pre-pandemic about this, I don't think we would have predicted that type of adoption if you think about it. The other thing that's happening is the care patterns are definitely evolving. And providers such as Tenet, right, and also some of the community health systems are really looking at opening up ambulatory centers. Because of COVID, a lot of the procedures have shifted to outpatient services. So that's, again, a huge shift in care patterns that's occurring. As this is all going on, there's quite a bit of shift and change that's happening in the supply chain disruption as well, where demand's been growing. There's quite a bit of uncertainty. The supply has not been able to keep up. We have clearly seen that during the pandemic with, a lot of you might have experienced it with hand sanitizer, toilet paper, even flour. I mean, there was a statistic I saw that I think toilet paper demand was about 847% over the regular levels, which clearly the supply just couldn't keep up, right? And given the adoption of digitization, customers now are demanding unprecedented levels of service. They've seen how Amazon operates. B2B customers are demanding that. So a lot of the business leaders are feeling that pain of, boy, how do we kind of scale our digital capabilities? How do we scale our supply chain? How can we really improve our customer experience and serve our customers effectively? And of course, there's labor shortages that are occurring as well. That doesn't help at all and support. And then of course, the players that are doing really well are the ones that are excelling at execution. And again, efficiency and in logistics has become a very significant source for players that are achieving the competitive advantage. So, I'm sure some of that is something you've clearly seen as well during the pandemic. And of course, COVID-19 has also surfaced, many of the things I just talked about, but the business leaders are rethinking their supply chain and their, transparency. How do they better support their customers? What capabilities do they need? McKinsey did a study recently, and 48% of the respondents said many of the planning decisions were delayed because of their remote setting, and then 85% of them said they really are struggling with inefficient digital capabilities to support their existing customer base, which caused a lot of angst in the system, if you may. And I think nobody would disagree here that data plays a key role in the healthcare industry. Claims data is critical, but clinical information from EMRs, the payers, and also some of the consumer sources, helps us kind of understand and better predict customer behaviors. But we could only do that. Some of the characteristics are very critical of that data for us to actually enable some of those use cases. For example, where is the data coming from? Is it of high quality? Is it timely? Do we have the right data sets to actually meet the requirements of our customers? What is the scope and completeness of that data? So, many of these questions are something, data leaders such as myself and others are truly battling with and working with to make sure that we actually can support our business leaders to answer the right questions and then ultimately support our customers effectively. And, I mentioned consumer data before. Consumer data is also proliferating, right? So there was Stanford did the study recently of many of the residents and students, but also physicians on, can data provided from self-reported data or from the apps or data from the wearable devices, et cetera, can that be valuable? And the large majority of them said absolutely yes, because physicians would see patients, at certain appointments. Between appointments, this data would really help them understand what the patients were doing that helps them really be much more proactive with care. And it was intriguing to see that even WebMD information was leveraged by physicians and by the residents to kind of predict and be a bit more proactive with care. And then, of course, and I'm sure you are seeing this for many of the leaders in the industry, for them to really keep up and support the customers, what's happening is there is, unsurprisingly, there's quite a bit of M&A that's occurring. Many of the companies are looking at data and analytics technology players to really look at how can they better, have insights and provide those insights to their customers and ultimately to the patient. So, a couple of examples that I'll take is Teladoc, and Livongo are two large players. They are now a large organization, and then Walmart did the acquisition of CareZone. Again, all of these acquisitions are mainly to ensure that better insights can be provided. You have the technology and the digital capabilities to provide those insights. Livongo is a good example where it actually gets the information from the devices and provides better effective outcomes to its diabetic patients. So this trend will continue for sure. Let me tell you a little bit about what do we do, and who we are as Cardinal. I don't know if everybody knows who we are. We distribute pharmaceuticals, manufacture and distribute medical and lab products. We also produce a lot of key performance and data solutions for many of our healthcare facilities. So a little bit of facts here. We serve about 90% of the hospital systems. We provide care to 3.4 million patients, with our at-home services. The specialty, physician offices we support are about 10,000. We have about 48,000 employees. We're in about 40 countries. So you can read the other stats, but really, we are in a critical link between the operational sides of the healthcare system and the clinical side of it. So we see the role that Cardinal plays is very, very critical in the industry. So let me talk to you a little bit about kind of the journey that we've been on from a data and analytics perspective, right? I think the journey didn't start in 2019. I just wanted to show you kind of the last 3-year horizon, if you may, so you all understand where we started from and where we're going in the near term and what our vision is. We on the medical segment, we had a tremendous amount of acquisitions that we performed. So clearly, with that, we knew that we really needed a data integration strategy, both for master data, and we also knew that it was important to have a unified data strategy. And we wanted to start with product data, given that we would both manufacture the products, but also distribute the products on the medical side. And of course, we're a global organization when it comes to our medical segment. We also started an analytics and an automation center of excellence. There was a lot of, we saw a tremendous amount of efficiency we could get by automation, by creating, leveraging bots. And so we knew that was a true capability we needed to establish. So I think that's another key thing we did in 2019. In 2020, one of the key things we also did was to really integrate and centralize an enterprise data organization that did operations, master data governance, and also stood up an analytics platform called Edna. You'll see that in many of these presentations. We call it the Enterprise Data and Analytics Platform. It was important for us to truly leverage a unified platform for us to do analytics. We, as you know, we grew by acquisition. We have several key within the segments too. We have several lines of business within the segment. So it was critical to have those sources, both third-party sources, internal data, aggregated, so we could actually have a clear methodology to produce machine learning models, et cetera, to produce the right insights and develop certain set of use cases. Where we are now is we've developed a business-backed data strategy. We have a clear platform both for master data and for our analytical capabilities. We're all about execution at this time in terms of how do we make sure that we, drive the right business outcomes, implement the right use cases, and drive those insights that support our business leaders and ultimately our customers. And then, of course, we, one other thing I wanted to definitely mention, we align this, our organization aligns very, very closely with our head of privacy, our head of security, and also a head of data retention leader, because we take all of that extremely seriously. We believe that the right, the way we've developed, and worked together in terms of kind of making sure that the right data policies, data procedures are stood up, we're meeting and exceeding expectations around regulatory needs that we need to meet, et cetera. So I think that engagement, I think is a very critical component of any enterprise data organization, and I think we've really done a great job of aligning with those groups. So let me talk to you a little bit about the data strategy and the work that we're doing on the data strategy. We started with some of the master data capabilities we acquired. We knew, as I mentioned, we had a very large organization, and we also, serve, about as I talked about, we touched a lot, about 90% of the hospital system. So we knew that we needed to be very diligent and also incremental in our approach. We knew that from a product perspective, we didn't have to centralize all the data in one platform. We could keep the segment data and have a unified view if required for analytics. Customer and supplier, we felt like we could actually unify it. Customer, from a geography perspective, we thought it was the right thing to do. And supplier, honestly, we think that globally we could have a unified supplier view, and that's how we're actually building our capabilities at this time. And then there are certain set of data domains that are very much leveraged by many of our growth businesses, like specialty and at home and others. Payer and third-party data are those where we think that there could be a unified approach we could take across the organization, and also have a clear view on the inventory of the information, also have the ability for us to provide as a data team clear view on what third-party data we have, what we don't have, and what insights and analytics we can provide to our business leaders. And of course, the corporate data is also very critical as we're, embarking on this digital transformation journey. Our employee data is very critical. We know that the right talent is very critical for us to kind of embark on that journey, and finance master data and overall finance data as well. And then we stood up something called an enterprise data governance playbook with the 8 components you see there. We've been very focused on, identifying critical data sets that are the most important, that make the most business impact, and really using that view to kind of cleanse, capture the metadata, but also really remediate issues that are there, and also provision that information to our business leaders. And I talked a little bit about kind of, we have capabilities now to tag the data. We use Colibras as the capability both for metadata and for data quality. So we're really excited to leverage quite a bit of the AI machine learning capabilities that Colibra provides. And we actually implemented their business metadata, and also we capture technical metadata in their platform at this time. And Peter, if there's any questions that are coming up, just let me know, but I wanted to kind of keep moving forward.
Super.
And then I talked a little bit about Edna. Again, you see, it was so important for us to establish a unified, we have a unified Google platform that we leverage, where we have a data lake, but also a very clear way of how we harmonize information to develop use cases, but also roll out insights in the organization. I mean, you're seeing a few use cases that are here, but I think we're really trying to kind of, bring a lot of core data sets into the platform, create that gravity, but also how do we make sure that this data is cleansed, governed, so that the insights that are produced are appropriate and trusted. So, we definitely have challenges there. As we're creating the gravity, we're identifying critical data sets and kind of following that methodology to make sure that we, the insights that are produced are trusted insights at this time. And of course, working closely with our technology, our internal audit team, our security team, to make sure that we are, following all the security, privacy guiding principles and the gates that are required as well. And then we have a whole innovation lab, and as I mentioned before, the third key component is we do provide data and analytics solutions to many of our healthcare facilities. I'll talk a little bit about 2 of them. We have a whole innovation commercial solution center that we use to produce these solutions. Outcomes is nothing but a digital platform that incorporates capabilities from 4 different capabilities that we have within Cardinal: mScripts, Outcomes, MTM, Telefarm, and Connected Care. It basically provides capabilities to about 23 million patients and about 60,000 pharmacies. The goal is that it helps, streamline the pharmacy workflows. There's better adherence, medication adherence, and patient engagement, leveraging these capabilities. And this really has helped pharmacies, scale their capabilities, given that they have this digital platform at this time. Blue Ramen is nothing but pharmacy reimagined, right? So you have 24/7 access to a pharmacist. You get text messages on your refills. It really enhances, it's basically personalized care. Improving the personalized care that's provided. So we're very excited that we've been able to launch Blue Robin as well. Okay, I'm going to move forward if there's no questions, Peter. So there's two use cases I wanted to talk about that are more data use cases as well. I mean, we've done tremendous amount of work as we're implementing the strategy. I could have spoken for about 4 hours if we talked about all the key capabilities and transformation that we're supporting, but I want to take a few and talk about it. One of the key things that, on the medical segment, the sales, marketing, and e-commerce executives challenged us was they really wanted to have the ability to look at alternative products for product substitution. And, have clinical equivalency for the products. I think what we did then was to really look at the industry standard GS1, created a proprietary product classification, and really helped push this product classification and integrate this with e-commerce and marketing and sales. And this really helped now have the ability for marketing teams and sales teams and e-commerce teams to really look at that and improve the customer experience, because customers were looking for clinical equivalent products. And also it helped our sales team meet their commercial goals as well. And the second use case I wanted to talk about was there was tremendous. I mean, I think this was even the first month that I had joined. This came up in conversations with our head of marketing and head of quality, that the unit of measure and weights and dims and data, how it's causing havoc in the supply chain transparency. So and we were taking that information, looking at the elements and remediating that, but we were doing that quite manually, right? We were profiling the information. We were like, gosh, how could we really speed this up? I know we were able to do about 5,000 products. We were able to remediate in about a month. We really wanted to accelerate that. And we leveraged AI and machine learning algorithm. And not only could we identify the issues, but provide clear recommendations of the fixes. And we were able to sit down with our business leaders and actually remediate that information. This saved, millions of dollars in terms of savings and freight costs and transportation costs. The supply, now the logistics team can do a better job of kind of planning their truck space and even the space in the warehouses. So this was like one of, if I had to think about like a huge success story, this was has been a very huge success story when it comes to the supply chain transparency work that we did in the last 13 months. Any more questions, Peter, before I move forward?
We do have some. They're kind of off track, but I did drop a bunch in the chat function there for you. We've got questions about data lake, trends and analytics. Would you like me to read a couple, or do you want to just keep going? And the rest of you keep putting questions in.
Yeah, it'll be good if you can. I mean, I have one last slide to close it out, so I'd be happy if you can kind of, start asking those questions.
Sure. So the first one is, what are the top trends for analytics in healthcare with your copious time in this job, right?
The trend, I mean, I think as I mentioned on some of the initial slides, right? I think there's definitely, the whole digitization and consumers really expecting digitization is a huge trend that we're seeing, Peter, right? And also that's one, right? The second one is from a just as a supply chain provider, right? The consumers are really looking for transparency and communication. Where is the product? When will it show up? Give us transparency on, when will we get the product? How quickly can you invoice us? How can you give us better pricing, et cetera? I think if I had to think about two major, I think the latter that I talked about, clearly that technology giants like Amazon have set the bar pretty high for companies like ours, right? So that's one trend of asking for, hey, I can tomorrow, and I can order a piece of clothing, and I know exactly where it is and how it's moving, and why can't, when critical products or orders, why can't I know where is my product, right? So those are the two big ones that are driving, I would say, are huge trends that we're definitely seeing.
Super, thank you, Ranjan. The next one here is, what best practice, and this one received a lot of upvotes, so it's clearly a popular question from Kevin. What best practices do you suggest for balancing analytics/data access and safeguarding PII or sensitive data? And you, of course, have no sensitive data in your environment, right?
Yeah, none at all.
None at all.
I think, I'll tell you, as a leader at Cardinal, and I think that's the true for any leader within our organization, there's no compromising, security and privacy of our customers and our patients. So we take that extremely seriously. So I think one of the key things that we have done is created, even in our platforms, both our master data platform and our Edna, which is our analytics platform, that's one of the key design principles, day one, that we implemented before we brought data into the platforms. So, so especially with PHI and PII, clearly upfront, we've had clear, policies, procedures, standards in place, plus security in place, both physical and otherwise, to kind of really maintain the sanctity that it needed. I can tell you there is a balancing act for other use cases around how do we really, make the data governance component super perfect before we actually develop insights and take it to action. I think the answer is somewhere in the middle, right? I think one of the things we're doing very closely is to ensure that as we're integrating our information, can we be a little bit more diligent on cleansing the data at source and bringing it in. So as we're developing the models, it's leveraging trusted data. It's not always the case. I think we do want to be definitely not stifle speed or stifle innovation, but it's also extremely important. I mean, all of you know this as data professionals. Your analytical models are as good as your data is. The insights you will get, if the data is bad, the insights won't be any good either. So that's one of the things that we've been very, working closely together to say, how do we balance that out? I think we're doing it by use case, and we're embedding data management and data governance principles as a part of every initiative now, which has really helped us kind of, change the culture in the organization quite a bit as well.
As opposed to retrofitting them or bolting them on afterwards or something else. And I'm going to take my producer's prerogative here and just ask you, would that answer have changed substantially if you were still back in the financial sector?
Not at all. Actually, it's not at all. Actually, I think it's the prerogative is even more there. Trying to retrofit things, Peter, and you know this very well, given your, your experience, that retrofit things after the fact, especially in financials, consumers there are extremely demanding, as you know, right? So clearly, I think there the answer was, and that's the mantra I've leveraged here as well, where you make data capabilities a key, integral part of any business capability that you're truly driving. And that's one way that that it's not an afterthought, and you think about information and, insights and governance as you're thinking about the capability enablement.
And you've just given us a very strong case for how careful Cardinal is about its data. There's a very specific question from Andy. It says, as you're getting more data about individuals, how are you making sure individuals are not re-identified with the added data?
So we are, I think, as I mentioned to you, I think we are very, very careful with our individual data and the patient data. I think we even have physically separated out platforms to make sure that we don't, we're not, leveraging that information period for things we don't have permissions to do, right? So as leaders, we've done, and also as a policy and a procedure, we've made that a practice within the organization to do so. So you will never, you'll not see that there's any overriding that would occur. Again, as I mentioned, we have tremendous amount of checks that we do, both data integration checks, but also like data governance checks, and we have clear, policies and procedures in place to make sure that that doesn't happen.
How much re-education, since you came as an experienced data leader to Cardinal, and it's not specific about Cardinal, but just the healthcare industry in general, how much re-education did you have to do? Because of course you came from a highly regulated, highly secure environment before, and you've gone into another one that was, I guess I could say we're still learning in healthcare.
Yeah, so I can tell you, I think financial services is definitely much ahead of healthcare when it comes to, implementing data practices, data capabilities, analytical capabilities, for sure, right? I think here, I had to learn more the industry itself. Again, Peter, it's a very highly regulated industry as well. Healthcare is very high, and the regulations, it's a lot to keep up with the regulations because they're always changing and there's new ones that are popping up all the time. So from that perspective, there's not that much difference between financial services and healthcare. I think that the big learning for me was it's a very complex, but also a fascinating industry. I feel for sure that you could make a true difference in, changing and, the outcomes to the end customer and patient in this. So that's one of the big reasons and motivation for me to switch from financial services to healthcare.
Super. Here's another question. How do you balance self-service / data democratization with the risk of people misunderstanding what they're seeing and drawing the wrong conclusions? I'm going to guess your answer is going to involve some sort of literacy.
Yes, there are two aspects to that. One is data literacy. We actually launched a key data literacy program 2 months ago. We're in the process now of fully designing a detailed communication plan. All of you know who Doug Laney is. He's going to help come in and help, roll this literacy program out, both to our leaders and also to many of the practitioners. The second key component, I would say, Peter, is leveraging capabilities like, the metadata management capabilities to really have people understand where is the data, who owns it, and where can they find it, or is it trusted or not, right? So one of the big things we're doing really is to kind of start to push out and have many of the data practitioners and consumers of data, have the ability to go by themselves and understand where to find it and how to leverage it. The third thing I would say is, I think you talked about democratization. Initially, we're at least having master data stewards and centralized within the enterprise data organization. But we're also seeing, clearly identifying line of business stewards in the medical segment, in the pharma segment, in various lines of businesses there. So we could really have a great way that we can collaborate so that they could actually implement these practices as capabilities are getting stood up and business capabilities are getting rolled out at this time. So
I'm going to draw on your.
I hope that helps, Peter.
I think so. Yes. Obviously, if it didn't, somebody will pop another question in, and we'll go. But I think that drawing on your experience again in the industry here, is there a good way to tell people they don't know? I'm thinking of the conversation that occurred between Rand Paul yesterday and Dr. Fauci, which was not, very favorable to Rand Paul. But, sometimes you just have to look at these folks and say, I'm sorry, you don't know enough. How do you deal with a situation around that?
Yeah, that is a tough one, right? I think what has worked for me personally as a data leader, I can tell you, Peter, is it's very hard to tell people you don't know. I think it's actually the other way around, where you say what is the capabilities we're enabling and the conversation we are having, whether it's insights to action conversation, or actually developing the insights itself, or automating a process, or really remediating bad data, or even integration capabilities that are absolutely necessary, is to tie all that to what is in it for them, right? So if we're talking to the head of marketing, one of the key principles I have leveraged, and I think many of my leaders on my team leverage, is what is in it for them, right? If we can talk about all the data jargon or the analytics jargon, but it's almost like if we don't do these 5 things, here from a capability standpoint, here's 5 things you cannot do for your customers, or for your that your leaders don't have the capability to execute, right? I think that conversation, Peter, has resonated much more than when we took the approach of, having them understand our 15 different initiatives we need to do in the data and analytics space.
In other words, more flies with honey than with detail.
Yes.
we data people do like to get into detail, but it is
Yes.
critically important to make sure they understand that. I'm curious if you've run into, you said you were working with AI and ML, and one of the things that we've noticed this year is that many of the learning algorithms are running out of data to train the ML algorithms. Are you experiencing that yourself directly?
We are still in our infancy, I would say. We have some advanced models, Peter, that we have developed. I think there are, I would say, maybe a couple of areas where we are running into that, at least in the specialty space. And we are seeing that, there's a whole conversation we're having around what is that data that we just don't have, right? That we don't have, whether we've acquired from third parties, or purchased from them, or we have internally, right? And those conversations are very active. So far, right, we are starting to think about what do we have and how can we really leverage and use that information effectively. But also we're starting to now think about what is that white space, and what is that the gap that we have that we really require for our AI and machine learning models to learn, right? So we're in the infancy there for sure, Peter.
But as you said, back to basics principles, if we don't get the requirements, not much else is going to go right.
Exactly.
It's amazing. I'm still seeing things, and I have to come back. And I know that Doug's involved in education. I know that you've been involved in educational initiatives around this. What are we doing wrong in the education environment that's not producing the kind of people that you want to be able to hire and put to work directly?
Oh boy. I think, I mean, and I think, Peter, you will agree with me here. I mean, I think, there's a lot of young professionals that are really smart that have come in and supported, many of the development of these capabilities, but people are hungry to learn, right? They want to learn one piece and then move on, right? A lot of times, some of these domains and areas, whether you're looking at kind of transformation in the supply chain and, organization or the manufacturing organization or logistics, if you have a sustained team that can really take, move the needle from a maturity standpoint, that's where, data leaders such as us can see the value, and also, our business leaders start to see the value. Sometimes we've had that, talent that comes in and they just want to quickly move and learn something else, right? So we are really, really pushing very hard to look at how do we make, both, leveraging data capabilities, learning how to model information as a equally important with, the domain. Do you know how we manufacture products? What are the products that we manufacture? Do you understand the sales process? Do you understand kind of our, quality processes, for example? So, and I think really kind of having specifically talking about a tenure where, hey, you do need in these roles, it's a 1-year role, not a low, smaller than that, has helped, our organization, but we're seeing quite a bit of attrition because the market's hot and this industry is so complex that they want to learn different areas fairly quickly. A lot of the data engineers and professionals do want to do that.
And there's so much to be learned around the technology,
yes.
but
yes.
we keep seeing, and this has been a theme about this year's conference, that 80% of the challenges are not technology related. They are people and process related.
Yes. And I can tell you that is the case with us too. It's people and process first than technology. Obviously, technology can help, leveraging technology, we can create some disruption, but if our business processes are broken, Peter, it's just super hard to kind of make it'll become a pure duct tape, right? Technology will become a crutch at that point. So
absolutely. I was listening to a podcast earlier today, and somebody had a wonderful word for put together with wire, MacGyver approach, something like that. Okay, we're going to change direction in this. You guys are still great questions that are coming in from our delegates here, so this is super. This one says, this is from Uma, what is your data lake strategy? Did you have to deal with multiple ERP systems, and how did you approach that being a distributor?
Yeah, we do. We do have, we do have multiple ERP systems, and we are bringing in information. But what we're starting to do is starting to look at the lake as a way to we literally have developed the metadata and a harmonization strategy, but it's hard, Uma, right? So we, as we're creating that data gravity by bringing in source data, use cases are helping us define what data do we want to truly harmonize, right? Because trying to harmonize information across 12, 14 ERPs is very, very difficult. So the approach we're taking is, can we harmonize information based on what business is really looking to drive insights in? And that approach has really helped us kind of develop the right data management and movement and harmonization strategy.
I was going to say,
I hope that helps.
It did. And that word strategy that you used in particular, a lot of organizations are trying to get a document, a 100-page document as a data strategy. And we've seen others that are taking a more adaptive approach and saying, our job is to be good for what's happening in the organization. How can we adapt what we're doing to best support the organizational objectives by providing better, higher quality data faster?
And I think, Peter, we talk about it all the time as an organization. We call it business-backed data strategy. That's why none of the stuff that we're working on is, every single thing that's on, our deck to complete this year or next year would be something that would impact logistics or a manufacturing organization or a supply chain organization. So we are now working on something just to stand up capabilities for the data team, right? It's all about, hey, if we don't do this, if we do this, the manufacturing team now can have transparency on all the raw material data at this time, or so that's the approach we have taken. That's why we call it the business back data strategy. So
excellent. Okay, sounds great. Another change in direction on the questions here. From your perspective, what went wrong? So from John, from your perspective, what went wrong and what went right in terms of data availability and data use during the pandemic, and what lessons can be learned from the past year? I think he's asking you to prognosticate on the entirety of society here. So go ahead and tell us what we've done right and wrong in the last. I'm just kidding.
I think what we have done, let me talk about what we have done right. I think we've leveraged, I will tell you, as a Cardinal team, we're an extremely tenacious organization. Obviously we're maturing our digital capabilities and our data capabilities. We knew that it put a lot of strain on, as I mentioned in the, in the previous slides as well. But, due to our tenaciousness, we've been able to really, help and support all the existing customers we have. We've had, I wouldn't say we haven't had our share of issues, but that's what we've really pushed. We also came up with a very small set of key priorities that change the way we work with our customers and improve our customer experience. I think I would say those are the two things that have helped us kind of focus and go. What we have not done so well, I think I would say more than not done so well, I would say the challenge that we're having is balancing, hey, how do we lay the foundation and do all the right things that are required to be done, plus move at the speed we need to move, right? That's the balancing act that we are constantly looking at to do. And I don't think any leader has figured out what that perfect answer is, but that balancing act is something that we do on pretty much a daily basis, and it's still a challenge.
And we can say that successful ones are still employed.
Yes, for sure.
So we're getting closer to the end here, and I don't see more questions coming up. I know you had some more material that you wanted to cover as well, but I did want to ask you somewhat of a personal question here about your own background.
Sure.
Your degrees are in communications.
That's right.
How has that been helpful to you as a data leader, and how has that maybe not been helpful to you?
Oh, I can't tell you how helpful that's been. I think that comes up as something that's a huge strength for me. I think of that as a strength, but more so, right? I think, it's funny. I was talking to someone 2 weeks ago about how every concept or capability or things we're doing as data and analytics leaders, it takes about 7 times for you to repeat and talk about it before it actually sticks, right? So
that's the number I use too, 7.
Yeah, it's actually, and I didn't realize there is a whole study on human, emotional intelligence and human behavior that's the number that they use. So, and I can tell you at Northern, I used to, it was something we would count and we would know. And so at Schwab, and I'm seeing that at Cardinal as well. I think communication, I personally think, is critical at all levels, especially for a data and analytics professional, whether you're an engineer or whether you're a leader managing governance or what have you. Because if you can't translate the impact and the capabilities that you're building have on the business, I don't think the business teams or your end customers and patients care about it, right? I think so. I would say it's probably one of the most primary skills that any individual should have, and it's really served me well. I'm extremely patient and persistent. So I think that's something that has that degree has definitely helped me, Peter.
Clearly, and people look forward to your presentations, as we do year after year on these as well. It's just wonderful to be able to have somebody be so articulate about these ideas, and I'm sure that Cardinal appreciates your ability to do that as well. Another question along the lines of, if this business is about communications.
Yeah.
I would ask you to comment on the following.
Okay.
Other disciplines are seeing the CDO role and seeing, I'll say, chaos. I don't know that I agree with that assessment, but this is what they're telling me. So I've had groups of accountants who are approaching me and saying, we think we would make really good chief data officers. And I've had some marketing people approach me and say, we think we would make really good data officers. I'm not sure it's so tied to the function as it is more tied to the individual who has these capabilities at this point. I'm not sure that's a fair characterization, but I'm interested in your thoughts.
I can tell you it's probably one of the hardest jobs any individual can have. I think, Peter, you would agree with me on that, because the skills that you need, you do need to know the business. You do need the technology and the capabilities that are required. I mean, that are ever changing, right? I mean, there's so many new, tools out there that'll probably make, the MDM strategy that we develop now is so different than the strategy that was developed 6 years ago, right? Mm-hmm. You can now have, data virtualization as a key capability that can be leveraged now that, 15 years ago, I don't think people knew what data virtualization was, right? I think the balancing act of having to really clearly understand the business, the problems, translate what data and analytics really support the business, both from a commercial perspective, operational perspective, also from a cultural change management perspective, and really translating that into what are the data priorities and analytic priorities and what technologies that support that. And so, if you think about it, you need all those skills, right? You need to have the business acumen, you need to have the ability to translate and understand what data sets are important, and then the ability to really kind of make an organized, prioritized decisions on what capabilities are right and how do you really truly execute flawlessly, right? A lot of times you either go through a lot of analysis paralysis, right? Where you just want the perfect solution. It'll take you 6 months and the business is tired and then they'll go build something else, or you're doing, you really have to find that balance. And those, those 3 skills, and really communicating very effectively as to why you need the capabilities, why you need the funding you need, why the talent is critical, and why, if business leaders don't, understand the impact, that this makes, that they can truly cannot transform the business and can transform the experience we provide to our customers or our patients. So I think that, and I know that was a mouthful, but I think that is the critical thing. And I know I'm not perfect. I'm sure I've made tons of mistakes in my roles before. I do that, I'm sure, now too. But I over so many, I've done data management, analytic roles for over 20 years now. And boy, you have to have all of that for you to be truly successful.
No question about it. And our real challenge that we have in data is that professionals don't think of data as a career until they've been in IT for about 10 years.
Yeah.
And so some of the initiatives that you're involved with, such as Women in Computing, and we'd probably like to have a Tykes in Computing too, if we can get down to that level. And, I'm sure those are going to be helpful in terms of getting everybody up. Yes. Ranjan, you said you had one more slide that you wanted to cover. I do want to make sure that you get a chance to do that.
Yeah, I had just one last closing slide that I want.
All right, we'll give our audience one more chance at questions too while you do
it. All I wanted to just leave you with is the fact that clearly personalized medicine and telemedicine came up as the top 2 key trends that the future holds. And I thought the metric here was very, very interesting to see that by 2025, the value of data in the world economy is over 3 trillion. So, I don't think, to your point, Peter, data is only growing. The insights that we can get from it are only going to be eye-opening, more eye-opening. And I think it especially in healthcare, I think the digitization and digital capabilities and transformation is going to be the new trend. So I'm excited about the journey in the next 3 years for sure.
Well, and I feel secure that you're in there helping at least one company do better with their data, because there's lots of others that need help. And everybody think about this. There's hundreds of you in this session here. And again, we've had a great talk, but you're the people who were interested in this in the first place. There are so many of our peers out there who are just getting exposed at the very edge of this. And they'll come to us, oh, I wish I could have discovered this 10 years ago. Yeah. So whatever we can do to push the word out, and that goes to everybody that's in the audience here as well. Let's make sure we can keep all this going.
Yeah, excellent.
Well, Ranjan, thank you again for one of a delightful talks. It's always a pleasure to see you and work in this environment, and your support of this particular event has been noted over the years, and your support for data leadership is putting you in the top tier of that. So we'll look forward to more continued guidance from you as we go forward.
Oh, look forward to it, Peter. That you're super kind with your words there. So I really enjoyed this conversation. And if there's any questions that come up, Peter, later, just have the attendees reach out to me. I think you should have my email address. So I'm more than happy to have conversations for sure.
We really appreciate your willingness to share. Thank you so much, Ranjan.
All right, take care. Thanks, everybody.